Welcome to another episode of your oral health and prevention podcast, Smiles in the Air. I'm Celso da Costa, and today with me I have Nuha Ahmad. So, Nuha, she is a dental hygienist in Saudi Arabia, a lecturer,
Yes.
also in the Department of King Saud University,
Yes.
right? In Riyadh.
In Riyadh, yeah.
Okay. So, you have a master's degree already in dental
I have a
education?
master's degree in dental hygiene education from the University of North Carolina. in
North
Chapel Hill.
Carolina.
Yeah.
Okay,
Yeah.
good. So they explain the English. That is such an American one.
Thank you. I've grew up traveling back and forth
Yeah,
from America, and my parents made sure that we know how to speak proper English early on. So, yeah.
that's good. I was talking a bad Portuguese when I when I was a kid for sure. So I have bad English now. It's okay. So tell me a little bit. How is being a dental hygienist in Saudi Arabia?
Well, first of all, I'm very happy to be here and talking to you in this podcast. I would say it's challenging, like being a dental hygienist, maybe in most parts of the world. It's empowering because there are no enough. You can never say you have enough dental hygienists. It was not my first passion. I wanted to be a dentist, but things happened, and then I was kind of forced to go into dental hygiene, but I came to love it and I grew in the profession. So before I graduate, I was like, nope, that's it. I want to continue to being a hygienist. I love what I do. I love bringing happy smiles to for my patients. So I want to say the dental hygiene school started back in 1983
Yeah,
or 82, 82,
82.
83. And it was within the College of Applied Medical Sciences in King Saud University in Riyadh. It's, I think, the first and the oldest dental hygiene program in Saudi Arabia. I would say the GCC. And it continued to grow from there. We still have, I want to say, a small amount of, or little amount of dental hygienists graduating every year. It keeps on increasing. Now we have a batch of 35 students, which we
Good.
never had. So I'm very excited for that because I feel like this will just improve the quality of dental hygiene services that we provide and empower us as dental hygienists.
I'm gonna tell you a secret. All the good or the best dental hygienists that I know, they never thought being a dental hygienist.
Really?
Yeah. It's true. It's a profession that you learn how to love.
Yes, that's very true.
Because you are getting into prevention, and we always think prevention is the future. Actually, we need to stop thinking like that. We need to think that prevention is the present.
Yep.
Even me, I wasn't supposed to be a dental hygienist.
Really?
I was a
Okay.
football player, then went to university, pharmacology, and I ended in the dental hygiene.
Interesting. So it was far from
It was
from
far.
medicine.
It was
or medical
far. And
fields.
actually, I went to a university because my mom said you cannot only do football, you also need to have something aside. I messed up my knee, and then, and then I went to the university more seriously, and it was the best thing that happened to me.
No, it was meant to be.
It was meant to be, and I learned how to love this because there was this community area from dental hygiene, going to schools or going to organizations. Do you have the same thing in Saudi?
We do actually. We have curricular community dental hygiene, and then we have extracurricular also. So it's very nice, and I think it's very, very well structured within the curriculum because each semester we target a different group
Yeah.
of the community. So it's school children or teenagers or geriatrics, inpatients, pregnant. So yeah, we do have these activities. Surprisingly, now you're talking about community health. It wasn't my favorite subject at all.
Really?
As I was a student, I loved only clinical. I loved
But
the
you said
interaction.
it
with the
wasn't,
student. It
so-
wasn't. I only
Okay.
just became to like it now, recently, because I guess going with the students and see how passionate they are about it, it gave me the boost to actually engage more in community activities. Like, I love the prevention and education in the clinic with the patients. But now, yeah, I think I have a balance of both.
Yeah, because as a dental hygienist, your first hat is not doing the job in the mouth of the patient, but it's educating the patient.
Educating, yes.
So it's changing the community by the habits already. It's changing habits.
That's true.
And this is difficult, but it brings such a positive vibe when we achieve even 10% of change.
Yes.
And this motivates students, I think.
That's very true. And because I'm in education, I always tell my students, you are the ones that are driving me to continue, and you are driving my passion and making me more motivated by seeing them very passionate about it.
Yeah, you have a boost of motivation.
Yes, exactly.
Yeah. But for me, it was funny because I specialize in the patients with special needs.
Nice.
And this was because we had a department that was with this special needs run by Fatima Bizarra.
Okay.
And at the time, my first patient on this department was a patient with cri du chat. It's particular. It's a person that when they try to talk or scream is like a cat.
Ah, okay.
So
I
that's
know
why
this
scream
now.
of the
Yeah,
cats,
yeah.
cri du chat. But it was so fun how the mother of this girl was there, like holding hands, how she was doing the effort to open the mouth, to let us work, how you follow this person for 2 years.
Nice.
And then you see the benefits that we are bringing.
That's amazing.
And it was, for me, it was mind-blowing, because that's why I specialize. And then, yeah, it was my kind of a baby.
That's super. Yes, that's super. And now, yeah, I do get the feeling of when you go to community activities, usually we go mostly to the malls. I want to say the extracurricular.
Yeah.
And you see all kinds of people coming, and they're curious and they want to learn. They actually want to learn. Like, and now I see the difference, because when they come to you in clinic, they're mostly complaining of bleeding or halitosis or whatever. So they want that focus, even though you try to give them oral hygiene instructions, but they're focused. But when they come and approach you in the malls or in any center, then you feel like they really want to learn. And whatever you tell them, they go out with a smile, and they're like, thank you. And they keep on looking at the tools that you have.
Yeah.
And yeah,
it's good.
so that's very nice.
But how come that you went for this dental education area?
Okay.
What motivated you to say, no, I want to train the next generation of dental hygienists in Saudi?
See, that's also tricky, because I've never seen myself as a teacher or as an educator. When I graduated with my bachelor's degree, the head of the department, he just called me and he's like, Nuha, see, we want you to come and work as a teacher assistant. I'm like, no, I already got accepted from 2 other hospitals, and that's what I want to do. I want to interact with patients, not with students. And then I just gave it a thought, and I was like, I'll try it for 6 months, and then it's either take it or leave it. And I found myself when I first entered the classroom. Like, I was like, yes, this is what I like. And when I thought about it, it's like teaching your student what you're actually passionate about. So yeah, I'm kind of getting the pleasure of doing both. I'm teaching my students how to treat the patients and also treating the patients at the same time. So yeah, that's how it started. It was never in my mind. So when I looked for master's program, and I found this master's degree in dental education, I thought it would be the best fit for what I'm doing.
For what
right
you are
now.
doing today. And how you see the future of Saudi, knowing that you are training their future?
Well, for now I see it blooming. I could say I see it blooming. We still, of course, we have some struggles, but we're working on having a master's program also in the department, and we also have an advanced diploma in dental hygiene with the Saudi Commission for Health Specialties. We're also working on like having executive programs, and maybe I could say the GBT is one of them. We're working on having workshops and some kind of advanced education other than what we're having in the curriculum until we can actually incorporate it within the curriculum. That's in the development. I also we have the Saudi Dental Hygiene Association, which was yani, kind of new. So, and I could say the new generation that we're having now, they're very passionate. They're very active.
You will
Like,
have an impact for the future.
yeah, they have an impact, and they voice their concerns. They voice what they want. They have, like, I think they're the future.
They're the future.
They're the future. And especially also we have the Vision 2030, which focuses a lot on the health aspect. So with that, prevention
Yeah,
is the most important thing. So we're trying to work on that also.
that's good. And how you compare this generation that you are educating and your generation?
I could compare them like it's very difficult to say because our generation were like more going by the book, like, and we're very good at what we're doing, and we have excellent grades. And but as they graduated, most of them are like on the quiet side. Each one is working in their clinic, they're doing their job, and that's it. They're not very active. I would like to say this generation, you feel like they're just hyper. They're all over the place, and maybe they're not academically as good as my generation
Yeah.
was, but they have a lot of other positive sides and like their passion, their willingness to teach and to reach out and to voice their I would say they're advocates for the profession. Yes.
But I think that's good. Right?
Yes, it's excellent.
It's pushing a little bit the profession to develop itself
Yeah.
also. And what I see between when I got out from university, I think was the year that things started to change.
Okay.
Like we weren't being seen as just the assistants of the dentist, but like a full profession that was developing. And in Portugal, as in Italy, we are called doctors, dental
Okay.
hygienists,
Okay.
because to get this health position that we are here to do the prevention of oral diseases, yes, but
Yes.
also general health diseases that can appear
That's true.
or can be influenced by oral bacteria.
Yes.
And this was really good because on when I was in university, it was the first time that we had the same classes with the dentists. So we
Okay.
were all together creating a duo.
Interesting.
And this had such an impact in these 10 years after that they were friends university. Now they are working together in the same
Nice.
clinic. The dentists do not start the treatment without having a full support from the dental hygienist that everything is stable. You can have the treatment and everything gonna be in the right place and gonna be maintained. This created a good synergy. And this is due to this hype generation that doesn't want to shut up when they have a challenge, but it like voice it over and voice the frustrations and try to find a solution.
That's amazing. Like we always have those for us in Saudi, we always have those clashes with dentists. Maybe because we are, as I told you, in the applied medical sciences college. We're not in the dental college. And we always have that resistance from the dentists, like you're taking over, what are you doing? But also from yani for us as dental hygienists, from day one, from when the program opened, we work individually in our clinics. I see this as good and bad because, as you said, you're not very close to the dentist. They feel like you're an intruder to their profession. But I would say this is changing over time. Like we have our yani, biggest supporters now are actually periodontists, which before they were our enemies. They would
against
fight
it,
us.
that we're gonna take their job, and
Yes,
finally said,
exactly.
no, we are helping.
But now, recently, I see that they are our biggest supporters because that they see and they know more about the profession. One of the things I would say also is that when dental hygienists do not actually talk much about themselves or educate people or patients or even their colleagues about their profession. So
Yeah.
as you said, they can treat you as dental assistants.
Yeah.
Some patients used to call the hygienist like sisters like a nurse or assistant. Or when someone calls you like a doctor and then they think that they're coming for cleaning appointment, cleaning, not dental hygiene, they say cleaning.
Yeah.
Then they think that you will take care of their cavities or clean the root or whatever it is. So now the new generation, they take their time to educate the patients about the profession of dental hygiene. And I think that's working great.
Yeah, I think so too. I think if we start with a patient and then we have backup, because I remember on my side, I had 3 professors, dentists, and all of them, they during the year they were empowering the dental hygienists.
Yeah.
Like I remember João Carames, that is now the dean of the university in Lisbon, Professor Duarte Marques or Professor Antonio Mata, and Professor Antonio Mata, every single lecture he started, you need to make the change. You need to work together, because it was dentists and dental hygienists being trained there. You need to work together. One doesn't work without the other one.
Exactly.
You are here to change what we are doing wrong since years, and that's stuck in my mind. Like it's right. And
it's right, and it's nice that he's saying it in front of a group of a dentist and dental hygienist. So each one knows their value and their place. Yeah.
Yeah. So Noah, you are making a difference. For
Hopefully.
Sure. What kind of advice do you have for the listeners of the podcast?
Well, I would say for dental hygienists, keep on doing what you're doing in the best way. Spread the passion, spread the motivation for your patients and for your colleagues. And I would say for dentists, please, please, please be more open to us as dental hygienists. We would love to work together. We're only here to help you get the best out of the treatment that you're giving to your patients. And yeah, that's it. I would love, if any of my students are listening to this podcast, I would love to say that I'm proud of you. I'm proud of what you're doing, and please keep on empowering yourself.
Okay, we will try to share as maximum as we can, and we will add that part for sure.
Thank you.
So thank you so much. We had a perspective of how it's going dental hygiene in Saudi Arabia. We are not only clinicians, we are educators, and if we want to change, like Peter Drucker said, the only way to predict the future is to create it, and I think you are creating it. Hopefully. So for the listeners, try to create also your future. Push it. We are trying to bring a new joy and new fun for dentistry for sure, but only if we collaborate together.
Exactly, and love what you do.
Yes,
love what you do.
Exactly. So thank you so much. Do not forget to follow our podcast in any platform that you are listening to. Smileys in the Air. This can be Apple Podcasts, Spotify, or even YouTube. So subscribe and do not miss the next episode.